It's another beautiful Sunday afternoon. Welcome to Ask the Pediatrician. Now, allergic rhinitis, commonly known as hay fever, is one of the most common infections that usually affect a child during the growing stage. And of course, it's one of the most common infections that a child tends to suffer from. That's the reason why today on the program we thought of discussing that in detail so that you can know whether your child is at risk of a hay fever or not, and of course what can actually be done. My guest on the program today is Dr. Emilia Jumbe Marsden, who is going to help us really look at this particular subject of discussion today. Dr. Marsden, welcome to the program. It's been a long time.
Thank you very much, Nelson. It has been a long time, but I'm happy to be here and discuss this important topic today.
Exactly. First things first, what is allergic rhinitis, commonly known as hay fever?
Yeah, so to correct what you said in the introduction, it's not an infection.
Mm-hmm.
So allergic rhinitis, as the name says, allergy and rhinitis. So when you say rhino, it's everything to do with your nose.
With the nose.
So it's allergic type thing that affects the nose.
Mm-hmm.
So it's a chronic condition. It's not an infection.
Okay.
It's a chronic condition that affects the nose. And basically what happens is that the lining of your nostrils are almost super sensitive to things in the environment that you're breathing in. And for simplicity's sake, we're going to call those allergens. So the allergens that you breathe in, they irritate the nose, the lining of the nostrils, and it causes inflammation, which is a medical term, but for the layman, we can call it swelling.
Mm-hmm. So
it causes swelling of the lining of the nostrils, and that swelling, when it's swollen, it makes the nostrils more super sensitive, and it becomes like a vicious cycle. So it's almost like an allergic condition that is chronic, that affects the nose, and it's not an infection. And as you've rightly said, allergic rhinitis is commonly called hay fever. Sometimes people like to say, I have nasal allergies. And sometimes now in my practice, I've begun to understand that when people say I have a sinus problem, they also mean allergic rhinitis. So there's different words that people use to call this what we call allergic rhinitis, but commonly I think people like to say hay fever.
What causes it really? Is it something relating to the DNA, the family background? Is it hereditary or something like that?
So you can say that it's hereditary because it's one of the conditions that people kind of inherit in an allergic manner. So it runs in families that have what we call atopy. And atopy in a simple way would be families that have allergy type things. So those are families that have maybe a family history of asthma, or if there's a family history of eczema, which is one of those skin conditions that are itchy, that are also chronic. So if one parent has either asthma or eczema, then you'll find that there's a 30% chance that that child will also get allergic rhinitis. If both parents have allergic rhinitis, then if both parents have asthma, then there's like a 50 to 70% chance that that child will have allergic rhinitis. So it tends to run in families that have allergies, whether it's asthma, eczema, or allergic conjunctivitis.
What are some of the basic symptoms that can help at least a parent know that the child has hay fever?
Okay, so the common symptoms that you see with children with allergic rhinitis, as we can see on the screen there, is that it starts with the nose. So you have a watery nasal discharge, like a runny nose, and it's usually clear, or sometimes it can be white. You have an itchy nose. You have nasal congestion, meaning that your nose can be stuffy. So it's either the nose is runny or the nose is stuffy. You can have where you have sometimes tearing, like not when kids are crying, obviously, but you can get tearing where the tears come out of the eyes. You can have itchy eyes, you can have red eyes, and sometimes you can have things like mouth breathing, because when you have your nose is congested, you are not going to be able to breathe with your nose, right? So you're going to end up breathing with your mouth. So sometimes people mouth breathe, like they breathe with their mouth, and sometimes kids can have snoring. Sometimes kids can have headaches. So those are kind of like the common symptoms that you see when you have kids with allergic rhinitis. And for me as a practicing pediatrician, what I tend to hear from parents is that my child always has this flu. And flu, when parents say flu, I've come to realize that they mean a runny nose. So they'll complain that my child is usually having a runny nose, or has this persistent runny nose that doesn't seem to be going away, or is usually stuffy or congested and it doesn't seem to be going away. Is usually having sneezing and it doesn't seem to be going away. So those persistent symptoms that are going on and you can't seem to get rid of those symptoms, those are the symptoms that need to be looked at and investigated. So if you have a kid who's having a fever, a runny nose and sneezing, that is not allergic rhinitis. But if you have a child who's having those symptoms that I've described and they are persistent, they are going on for over 2 weeks, 3 weeks, 4 weeks, okay? So if those symptoms are going on for over 4 weeks, we start to worry and start to say, oh, probably this child has allergic rhinitis or hay fever.
Okay, well explained there. Now, maybe for the sake of somebody who might actually be thinking in that line, does allergic rhinitis also affect? There are some people who really bleed at some point.
Mm-hmm.
Exactly.
Yeah.
Does allergic rhinitis also affect that?
Yes. So that's one of the other complications that can happen with allergic rhinitis. You can have repeated episodes of nosebleeds. So you can imagine that our nose, the middle here of our nose, it's very vascularized. What that means is that there's a lot of small little blood vessels that are on the bridge of our noses. And if we are saying that your nose, the lining of your nostril is inflamed or swollen, then those little blood vessels can also get swollen. So if you are sneezing, coughing, or sometimes, people tend to rub their noses this way or that way, it can cause those little blood vessels in the lining of your nostrils to bleed. So yes, having nosebleeds often is another one of those symptoms that can suggest that you have allergic rhinitis.
How is it diagnosed?
So the diagnosis of allergic rhinitis is usually clinical, and you can imagine that having a runny nose, having sneezing, having sometimes even coughing is quite common symptoms that we see in children. So the diagnosis is usually made clinically in terms of we take a good history and we find out what symptoms this child is having, and then we put the symptoms and signs together and then we make a diagnosis. So from the history, what I described in terms of the symptoms of what the child is presenting with, we look at those symptoms, how long those symptoms have been going on for, and then we do an examination. Okay, so when we look inside when we go to the doctors and they have that little torch that most of the times we tend to look in the mouth, mm-hmm. But it's important as a doctor or a clinician to also look in the nose. So we look in the nose and we look in the nose to see, does the lining of the nostril look swollen? Is it looking a bit pale or bluish? Those symptoms, those signs that you're seeing will help us to say this child has allergic rhinitis. But we need to also remember that sometimes the symptoms of allergic rhinitis can mimic other conditions. So when we're looking at the diagnosis, it's important to rule out other conditions. So sometimes we might decide, let me do an x-ray, because when you're dealing with kids with allergic rhinitis, other than the symptoms that I've mentioned, sometimes because that mucus, if you have mucus running, it will run to the front of the nose, right? And parents, what do? they just wipe the mucus. But sometimes that mucus can drip behind the nose, okay? And the dripping of mucus behind the nose is, sometimes you find parents saying, oh, my child has a bad breath, or sometimes they'll say, I keep hearing my child clearing his throat, because if you've got mucus dripping to the back of a nose, the kid will be like, or those kind of things that kids can do. So we need to think about other conditions that can affect the back of the nose that can cause snoring or mouth breathing. And an important condition to rule out would be something that we call adenoids. I'm sure some parents out there who have had children who they go and see their doctor, or they go and see their clinician, or they go and see the ENT specialist. They've been told, oh, I think your child could have adenoids. So what are these adenoids? Because they are swellings that appear at the back of the nose. So sometimes, as part of the investigations that we need to do to make a diagnosis, we'll say, okay, we need to take an x-ray and see if this kid also has an adenoids. In addition to that, sometimes because it can also affect, like the little pockets that are on the face, your sinuses. So sometimes, depending on, how severely certain symptoms present, some doctors may decide to have like a CT scan done of the sinuses. Sometimes we might decide to do like allergy tests. Okay, so all those things help us to say, okay, does this child look like has inherited some sort of allergies? And if that's the case, shall we look at what it is that could be irritating the breathing passages that are causing this child to have these symptoms? So in short, we look at the clinical picture, and we may decide to do like either an x-ray, a CT scan, some blood tests that help us to say, oh, does it look like this child has inherited some allergies? And if it's possible, what specific allergies is it that this child is presenting with? So all those things together help us to decide, help us to make a diagnosis of allergic rhinitis.
All right. Now, when we come to the age group of a child, which age group seem to be more prone, or when allergic rhinitis tend to come out more more frequent, more often? Is it the first 1,000 days, or maybe when the child is about 5, or maybe as the child is now progressing beyond 10 years of age?
So that's an important question, because generally, if you recall what I said in the beginning, you have to have exposure to things that you're breathing in that are going to irritate the lining of your nose. Okay, so it needs time for that exposure to occur. So it's not very common in kids under 2, but we have seen, because sometimes kids who are like a year or 18 months old can have exposure to the things in the home that can irritate the lining of your nostrils. So when I talk about allergens, I'm talking about things like house dust mites that can appear in your carpets. We're talking about cockroach dander. If you keep pets, we're talking about pet dander. These are things that are released from your pets. So under 2, it's not very common. Generally, it tends to be more common after the age of 3. So we're talking between 4 and 6. But it's much more common in kids that are older than 6. So we're talking 7, 8, and 9-year-olds. So the younger the child, the less common it is. The older the child, kind of like the pre-adolescent age, that's the age group that we tend to see the symptoms appearing more.
Okay, so now, Doc, when you look at allergic rhinitis, obviously the older the child gets, the more it actually comes out. Exactly. So now, if we were to look at it from African perspective, how common is this condition here in Africa, for example, here in Zambia?
Okay, so at the moment we don't really have our own specific statistics. There was a study that was done about 4 years ago, and it was a questionnaire-based study which looked at asking preschool kids.
Mm-hmm.
So this was 6 to 7 year olds and 13 to 14 year olds, and we used a questionnaire to ask them this hay fever. So when people hear hay fever, they think there's fever involved, and that's why they think it's an infection, right? So we're not so sure whether that component of the questionnaire was really understood well, but it went as high as 23% of the kids that we had interviewed said they had these hay fever symptoms. But like in the West, it ranges from anything from 15 to 20% of children have hay fever symptoms. So it's a very, very common chronic condition that we see in children.
Okay, let's come to treatment here. How is it treated, and how long does the treatment of allergic rhinitis really take?
Okay, so I think it's important to understand that we're dealing with something chronic,
Mm-hmm.
right? So it's a chronic condition. Just like when you have either asthma or you have epilepsy or diabetes, it's chronic. So it's important for parents to understand that in terms of treatment, there's 3 things that can happen. So the first thing is avoiding the thing that you know is triggering your symptoms. So remember I said that the thing that trigger the symptoms is things that we're breathing in, right? So there's things in your home that will irritate your breathing passages, and there's things in the environment that will irritate your breathing passages. So you can imagine, Nelson, if I'm saying that grasses and trees are the things that are probably triggering your hay fever, how possible is it to avoid that? It's almost impossible, right? Because you are surrounded by grasses, you're surrounded by trees, you're surrounded by shrubs. But in your home, what you can do, so if there's mold on the wall, like especially sometimes in the rainy season when it's damp, if there's mold on the wall, you need to get rid of the mold. There are certain types of things like pillows. Luckily, I don't think in Zambia a lot of people have feather pillows, right?
Mm-hmm.
Do you think people in Zambia have feather pillows? So feather pillows are some of the things that have been known to be harborers of these same house dust mites that we're talking about. So avoid those kind of feather pillows. You can use covers. If you've got lots of carpeting in your home, it's better to have those things out if you see that your child's symptoms of allergic rhinitis are quite moderate to severe. So in the home, that's what you can do. It's a bit more difficult outside of the home, and sometimes the other thing that you can do in the home is if in our rainy season, which is when we see a lot of grasses and trees and flowers, these jacarandas, these flamboyants, they are all blooming. You can close the windows, okay, when you're in the home. But can you imagine how hot that would be in our country? So it's quite tough to do those kind of preventative measures. However, when we come up so that's the avoidance, right?
Mm-hmm.
But when you come to the treatment using medication, the treatment using medication involves different things. So because we know that histamine is involved in the allergy process, what we do is that we can give oral antihistamines. We can also give medication that you can spray in the nose to clean the nose, which is called saline, which is salty water, just to clean the nose and remove the mucus. We can also use special types of nasal sprays that reduce the swelling in the lining of the nostrils. But because this is a chronic condition, it means that you're going to be using those medication for months, because sometimes these allergic rhinitis symptoms, they can appear as a seasonal symptom. So in the developed world where there's 4 seasons, you might say, oh, it appears in spring when things are blooming. In Zambia, it tends to be like a lot more in the rainy season because that's when things are growing, plants are blooming. So you might find that some kids have symptoms during that particular time, in that particular season. So for that child, we'll say, you know what, use these medications during this time. And then for the other time, we don't use the medication. But for the children that have symptoms all year round, unfortunately, it means that you have to use the medication all year round. Because remember that the allergic rhinitis, it's chronic and it's inherent in the person who has it. So that's the second mode of treatment. The third mode of treatment is really not available in Zambia. Okay. So I'm not going to spend too much time talking about it, but in countries where they can actually specifically identify. So for example, we know that this child's allergic rhinitis is triggered by jacaranda trees, okay? So when we know that jacaranda trees are the seasons when this child has these a lot of symptoms, what you generally do is that you say, okay, we're going to give you what we call immunotherapy. So it's like giving you small doses of the thing that actually we know is triggering your symptoms until your body gets resistant to it, okay? But because we don't have our own indigenous medication, it's not a form of treatment that we have in this country. So those are the three modes of treatment when it comes to allergic rhinitis.
So in most cases, when you're dealing with allergic rhinitis and of course a treatment, what you're looking at is trying to falsify the immune system, trying to deal with the symptoms. Is that so?
Yeah, so it's two things. Mm-hmm. The first thing is avoid the thing that we know triggers your symptoms. Okay? So for example, if you know that for certain things it's difficult. So if, for example, in homes where they've got pets, right? So you've got these kids who are so happy and used to their little dog, and then when you realize that, oops, you know, we introduced this dog in the home. Since we introduced this dog in the home, this little kitty of ours has been having watery eyes, runny noses, sneezing, coughing, a lot of sore throats, okay? Then imagine trying to tell your little 6-year-old that, okay, we have to get rid of the dog, right? It can be hard, but the first thing really is avoid the things that you know are triggering the symptom. And the second thing is we are just reducing the inflammation in your nose. The immune therapy is, yeah, in a way, is like what you're saying. You're trying to trick the immune system by bombarding it with this thing until it becomes resistant. But like I said, it's not a really feasible option in this country.
Okay. All right, so ladies and gentlemen, you're still watching Ask the Pediatrician, and of course my guest on the program today is Dr. Marsden. Our topic of discussion is allergic rhinitis, which is commonly known as hay fever. Okay, so it's not necessarily an infection, but it's a chronic problem, and in many cases, the older the child gets, that's when it becomes quite prominent, as the child is now being exposed to the environment. We've discussed the symptoms and of course the causes and what it is, but we are yet to come to some complications. I think I overheard the doctor talk about some complications of hay fever, so she's going to explain more on the complications. But before we go for a break, when we talk about some of the effects of hay fever, obviously apart from what you talked about, I have seen what flu can do to a child. Sometimes flu can make a child feel like he or she has got malaria, and especially when it's coming out. Is that there's also the same case with, you know, allergic rhinitis, whereby sometimes a child might actually feel feverish, malaria-ish, and stuff like that?
No. So it doesn't cause those kind of generalized body achy feeling, or it doesn't cause a fever. So I think it's important for parents to understand that it's allergy based. It's not infection based. However, that said, there are certain things in terms of the complications that can cause a fever. Okay, so with allergic rhinitis, the symptoms are not going to be like where a kid is, down with complaining that they've got generalized body aches and pains. But remember what I said, that some of the symptoms that can happen is that they can have a headache. Okay, and their nose is so congested, and they keep getting mucus dripping to the back of the nose. They are coughing. They are having, because of the nasal congestion, disturbed sleep, okay, and sometimes disturbed appetite, okay. So when you have that kind of thing where you have difficulty in breathing, it can affect your sleep. So the picture that's on the screen right now is the thing I was talking about earlier, about some of the things that you need to think about when you are dealing with a kid with allergic rhinitis, because the symptoms can be similar to what's on the screen right now, which is called adenoid hypertrophy or enlarged adenoids. So if you look at the screen on the picture on the left hand side, the little adenoids, they are found at the back of your nose. And over time, because kids are always having these upper respiratory tract infections or flus or colds, the adenoids can swell up, and they can swell up to, if you see the screen, it's quite a big swelling at the back of the nose. And what that does is that it blocks the breathing passages. So usually you have kids who are also having difficulties in breathing at night, snoring at night, which is another symptom that is similar to allergic rhinitis. So it basically causes symptoms that they affect your quality of life. Okay, you find kids are always missing school because they've got runny noses or they can't breathe. They can have ear infections because they're blocked up in their upper breathing passages. So it affects more the quality of life of a child as opposed to body aches and pains, or like what happens when you have malaria.
Okay. Wow, indeed. All right, so just about now we go for a break. When we come back, we now zero into the complications, some of the notable complications that may come as a result of allergic rhinitis, which is commonly known as a hay fever. So for now, we take a break. We'll be back shortly, and of course, we're also going to probably touch on the prevention as well. Obviously, yes, though generally in most cases many people feel or believe that chronic conditions usually are difficult to prevent. Let us get it from an expert when we get back. Stay tuned.
Hey guys, I'm about to become a first-time dad, but I'm stuck in traffic. Help! Guys, let's help this new dad get to his firstborn. Come on! Thank you. We did it.
Live the 4G experience. Airtel, the smartphone network.
It's learning time and playtime. You know what they say. All work and no play makes Jack a dull boy. Join the adventure. Let's create, let's explore, let's grow, and let's discover. Tag along and join the coolest club, Q Club. every Mondays at 16:30.
Your favorite music video show. In terms of music videos, we have the latest, the most trending, the most happening.
Remember, say I told you we're chilling with the prettiest and coolest girl on TV road. So stay glued to QTV, you know, log on.
All right, so welcome back to everyone who is just tuning in. You are watching Ask the Pediatrician. My guest on the program today is Dr. Emilia Jumbe Marsden, and of course she's explaining on allergic rhinitis, commonly known as hay fever. Obviously, there are quite a number of questions in relation to why it's usually called hay fever, especially that it's not an infection but a chronic problem as well. All right, so now, Dr. Marsden, let's now get into a more complicated part here. Complications as a result of allergic rhinitis. What are some of the notable complications that may come as a result of allergic rhinitis?
Thanks, Nelson. So I think the commonest complications that can happen in children are usually things like repeated episodes of ear infections. So because there's a tube that connects the middle of the ear to the back of your throat. So if you can imagine that your ear, nose, throat, they're all connected, and if you've got swelling, sometimes you get blockage of that little tube and you get fluid accumulating in your middle ear. And sometimes you find that kids have repeated episodes of fluid coming out of their ear. So repeated episodes of middle ear infection, that's one of the complications, or repeated or recurrent episodes. And sometimes it can be so bad that it affects a child's hearing. So you can imagine there's not supposed to be fluid in the middle ear cavity, but it's supposed to be air. So if you keep accumulating fluid in the middle ear cavity, it can actually affect your hearing. One of the other complications, other than repeated episodes of ear infection, is that you can get what we call sinusitis, okay? And I think this is, from coming on, is what I've come to understand when people say, oh, like when I ask, is there any episode of hay fever in the family? They'll say no. So the picture on the screen right now, it tells us what your sinuses are. Your sinuses are little pockets of air that give us this this little prominence of your forehead, the prominence of your cheeks. So those little pink areas are your sinuses. You know where it says the frontal sinus, the ethmoid, maxillary, these are all pockets of air. And they're supposed to be air in them. But because you are having repeated episodes of flare-ups of your allergic rhinitis, repeated episodes of inflammation or swelling, you get mucus accumulating. So if you look at the screen there, you'll see on the right-hand side, those yellow bits, those are areas where the fluid has accumulated in the sinuses. So if there's fluid sitting and festering where it's not supposed to be, they're more likely to get infection. So those are the times when you can have a fever. So that's where the fever component can come in. And you can imagine it's on your head, on your face. So you find that the people who say, yeah, I have sinuses, and they're always getting a headache. That's because the sinuses are where? They're on your head, they're on your face. So you can have recurrent episodes of headaches and recurrent episodes of sinusitis, okay? So sinusitis is another important complication of allergic rhinitis. So you can imagine, like, if you've got constant headaches, you're constantly blocked up or congested, you're constantly having mucus dripping to the back of the nose. The other thing that may happen is that you can have difficulties with sleeping. Because you're not comfortable. You have to breathe through your mouth, right? Instead of breathing through your nose, which is actually blocked. So insomnia or difficulty with sleep is another thing that we hear a lot from our parents. The kid is snoring, mouth breathing, and in this age of smartphones, parents will actually come and say, "Doc, listen to how my child is breathing. This is so scary," And then when you just say, "But that's just snoring," they can't believe it. They'll be laughing like, no, this is not snoring, but it is. So sometimes the kids will have snoring. Sometimes they'll be irritable because they're not sleeping very well. They'll have constant headaches. They'll have, the other complication is that you keep on having repeated episodes of sore throats, okay? Because you're constantly having this dripping in the back of your throat. So those are kind of like the main complications that you can get with allergic rhinitis.
If a child repeatedly gets nose blockage due to this, any practical steps that can be taken to treat that particular problem? Are there instances where a surgery or anything can happen?
So usually with allergic rhinitis, it's very rare to require surgery, okay? Because the symptoms can easily be treated non-surgically. So for example, when you said if parents are having kids with nasal congestion, what they can do at home is simply clear the nose, okay? So we clear the nose with something that's very, very simple. It's called saline, and saline is just salty water. But sometimes I get parents saying, "So how much water, how much salt should I put to this solution?" No, I don't mean make the salty water at home. We encourage parents to actually go to a chemist, go to their health care center, and actually get the saline that way. So we get the saline and you irrigate or you clean the nose. Now you can imagine for smaller kids that are like 3 and below, 4 sometimes, they can't actually blow their noses, right? Because you can spray some salty water to clean the nose, and then you ask them to blow their noses. So for those kids, and I'm sure this is something that a lot of parents nowadays, when they're having babies and they're having baby showers, they'll get a little something that actually the parents can use themselves. And if you recall, in the days where the grannies were doing what? Sucking, right? They were literally they were literally sucking the mucus with their mouth or from the baby to help the baby remove the mucus. I mean, nowadays there's more hygienic ways of doing it, right? So you either have a bulb aspirator where you put the bulb on the child's nose and it sucks the mucus out, and sometimes you can also use something that you put a pipe in your mouth and it goes to the child's nose and you suck out the mucus. There's a common brand that's called a nose frida. It helps you to you spray with saline and you suck out the mucus. So cleaning the nose with saline is another very effective way of reducing the symptoms that kids with allergic rhinitis can present with.
How about when a child is now progressing in age and possibly they're now catching up with their teenage? Does the condition really lessen or it becomes worse?
So the unfortunate thing with allergic rhinitis is that most of the times kids grow into adolescents and adults with allergic rhinitis. There's very few children that actually outgrow the condition. So some children, the symptoms eventually disappear, okay? But the common thing is that if you have a kid with allergic rhinitis, most likely they're going to become teenagers with allergic rhinitis. They're going to become adults with allergic rhinitis, they will become that adult who says, I have a sinus problem, okay? And that's what generally tends to happen. And I think it's important for our viewers to know that if they suspect that their child has allergic rhinitis, we need to look for the other things that kids with allergies can have, okay? Because those things can mimic just allergic rhinitis. So, you know, it's important for them to know that up to 70% of us kids who have asthma who have allergic rhinitis. So if there were 10 children in here with asthma, 7 of them, up to 7 of them can have allergic rhinitis. So they tend to go together, you know, eczema, allergic rhinitis, and asthma. So it's important when you have a kid with allergic rhinitis that you actually rule it out, okay? You rule out that that cough that this child is having at night or early hours of the morning is being caused by mucus dripping to the back of the nose because of allergic rhinitis and not because of asthma. So sometimes when we are looking at children and how they are presenting, we will think, okay, in the older child, we might say, you know what, let's do some other tests, like maybe a lung function test, and see whether this child possibly, this cough that this child is having, is it being caused by asthma or is it being caused by allergic rhinitis?
Doc, obviously, when we were growing up, really, I'm sure you've seen situations where a child doesn't necessarily really have flu, but they're just so prone to a lot of mucus. Exactly. Whereby, you know, people exactly. Could that be related to allergic rhinitis in one or the other?
Okay, so remember, I think it's important for parents to know that, firstly, common colds or chimphines, they are very common. That's why they're called common cold. So kids can have, like in the under 5 age, they can have anything from 6 to 8 and sometimes up to 10 chimphines, okay? So that's one aspect. It's common, especially when kids start going to school or preschool, because there's a classroom with 20 or 25 kids, and sometimes, like in some of the schools, there may be 40 kids in a classroom. So one or two of those kids may be having a flu or a common cold. So it's obvious that, you know, it's going to be common. However, that said, runny noses go with common colds, right? So the common thing is that the runny nose of allergic rhinitis, it's usually clear, like water, or it can be white. When you start talking about this yellow, thick, greeny type mucus, then it's mostly caused by viruses, the common cold virus. So that can help parents to say, is this allergic rhinitis or is this a common cold? Okay? The color of the mucus and how long that mucus has been coming out. The common cold, it will be there for 5, maybe 10 days, maximum maybe 2 weeks. But if this kid has been having mamina, runny noses for a month and a half, then we're not dealing with a common cold, okay? So the duration is another important aspect that helps us to say, is this a common cold or are we dealing with allergies?
Okay. Well, earlier on, before we even went for a break, I think I brought in an aspect of you know, prevention. Exactly. Obviously, it's easy to prevent an infection, but now we're talking about a different, you know, problem altogether. So I don't know whether, you know, the issue of prevention can come into play right now.
Okay, so as we said in the discussion that we had off camera, so it's difficult to say you can actually prevent it because it tends to run in families, but there are certain things that run in families, whether it's asthma and allergies, which things like breastfeeding your kid, your newborn, helps to reduce these allergy type things. So that's one very good preventative measure that you can take. Okay. However, once you actually have the allergic rhinitis, because remember I said that when we're dealing with a family where one parent either has asthma, eczema, or allergic rhinitis, there's a 30% chance, just because the fact of your parents have this condition, there's a 30% chance that you will have it. If both your parents are asthmatic, then there's like between 50 to 70% chance that you will have it. So it's, you know, it's inherent in your genetics, okay? But in terms of if you do have it, how can you prevent the flare-ups or the symptoms worsening, okay? And that can be done through avoidance of the thing that you know is the trigger for your symptoms. So some things are easy to avoid, right?
Mm-hmm.
So it's easy to avoid if you know that when you go to your granny's house and there's so many little dogs at your granny's house, and when you go there, you have to ask granny to come and visit you at your place, okay? If you know that we've got thick rugs in the home and they are harboring dust mites, then you need to remove those things. So you remove the things that you can avoid. If it's like our rainy season and there's lots of pollen in the air coming from the jacaranda trees, the grasses and whatever, when you're in the home, you can close your windows, okay? And this is where, obviously this is not practical to everybody. Those people that have, like in your studio here where we're sitting, it's nice and cool, right? Because there's air conditioning. You can close your windows and, put the air conditioning. But if you can't afford those kind of things, which the majority of people can't, it's just about closing the windows. And unfortunately in our environment, it means that you're going to be sitting in a hothouse, okay? Yeah, so there are things that we can try and avoid, but unfortunately, things like in the environment, the kids like to play outside, right?
Mm-hmm, mm-hmm.
So, the playing outside on the grass, you can't now say, little Henry, you can't go outside and play, because he wants to be a kid, right? But those are the things that we can say, you know what, let's just be consistent with using the medication that we know helps to keep the symptoms at bay, okay? So that this kid can still go outside and play with his friends.
Finally, if at all, the parents have recognized, or they have, they have, let's say, seen the symptoms that you earlier alluded to, what should they do?
Like with anything, it's important for parents to be able to be aware that are these symptoms going on beyond what is typical,
Mm-hmm.
okay? What is typical is, and I always tell my patients that if you're having a cough or a runny nose, sneezing, your cutoff is always going to be 2 weeks, okay? If this kid is playing around with no fevers. So as a parent, if anything, obviously if a kid is having a fever, runny nose, coughing, that doesn't tell us that it's allergic rhinitis. That tells us that that kid has an infection. So the important thing is for parents to be able to understand that this is not allergic rhinitis. This is an infection, and we need to go to our healthcare provider.
Mm-hmm.
Okay. So the first step is go to your healthcare provider. Okay. Whether it's at the health center, which is your regular healthcare provider, whether it's at a clinic, whether it's at a hospital, go to your healthcare provider and have those concerns addressed. Okay. Because like I said, complications, when you let things fester, you end up with ear infections. Your child may end up having hearing problems. Then they might end up not, being in class, concentrating because they constantly are having headaches, or they are constantly missing school days. Okay, so you end up with sometimes behavioral problems with children. So anything that is outside of what is typical, go to your healthcare provider and get it addressed.
Well, Dr. Marsden, thank you so much for coming through today to take us through allergic rhinitis.
Thank you, Nelson.
And I'm sure that now our mothers there. I love talking about mothers because they are quite attentive.
Are you insinuating? Are you insinuating that fathers are not attentive?
Well, quite a little bit busy for them to notice some of the symptoms that you've talked about. But for mothers, so right now as we speak, obviously mothers who've got little kids have already started looking at the noses and of course started observing, the behavior of their children.
Yeah.
So I think it was quite helpful.
Yes.
Thank you so much.
Thank you, Nelson.
All right, so ladies and gentlemen, well, that's it for today. Otherwise, we've been discussing allergic rhinitis. Quite a lot has been talked about. So it's important that we keep on assessing the growth of our children. Both dad and mom, let us pay attention to the growth of our children. And of course, this, delicate information that comes through this platform, make sure that the moment it reaches your earrings and of course you receive it, start using it in terms of making an assessment of the growth of your child. I remember in the previous episode, a certain lady actually asked us to discuss bronchitis and of course asthma. I can gladly announce to the lady that in the next episode we'll be discussing asthma. So that should be of interest to her as well, and of course to so many other people out there. But for this episode, wow, we've been discussing allergic rhinitis, which is commonly known as hay fever. And please, the hay fever name should not mislead you into thinking that allergic rhinitis is an infection. It's actually a chronic problem. So start observing your child, and the moment you notice some of the symptoms that Dr. Marsden pointed out earlier, please visit your healthcare provider and they will be able to make a diagnosis and of course be able to be of help. If you are keeping a child who is who already has this particular a problem, please make sure that you follow the steps that Dr. Marsden highlighted in terms of how you can actually ease the condition for your child. I'm sure that it will definitely be very, very helpful for your child. I've been your host, Nelson Zulu. Until next Sunday, it's bye-bye and God bless.